while growing up, or let me say in 2021, I almost lost my friend. I say this everywhere so that people would know that starting the organization was not because I want to start it. Of course, it's stressful running an organization, especially in Nigeria, funding and all that. We are still going to come to that. But I want people to always know that I didn't just start this because I wanted to start it. I didn't start it because I'm a midwife. I started because there was a pain. I saw a pain, and after that I was like, okay, you know what, I don't want any woman to go through this. We need to do something about it. So in 2021, I almost lost my friend. She was having her fourth baby, her fourth child. So when she had her first, second, third, there was no issue, there was no problem. So when she was having her fourth, there's something in midwifery, there's something called uterine atony. Uterine atony is just simply the inability of the uterus to contract. I mean, as a woman, once you deliver, naturally, God has done it that way. Your body, your uterus will start contracting on its own naturally. That's why when you deliver, when a midwife delivers you, they give you, when you deliver, I don't know if you're married or you've seen someone delivering, you see them, they give them certain injection here or they give it on their laps or something.
Yes.
That's oxytocin.
Okay.
The reason why they are giving them that oxytocin is to ensure that the uterus helps the uterus to contract faster so that the woman doesn't bleed. Right? But either you give that thing or you don't give that thing, the uterus will contract on its own. But as science has gone and research and all that, they realize some women do not have enough oxytocin to contract. So that is why they say, okay, when you deliver a woman as a midwife, you give oxytocin immediately. So that even if that woman's uterus doesn't want to contract, that thing you've given her externally will help her to contract. So I'm just trying to say the genesis of what happened. So our womb was not there. She wasn't contracting, even after the oxytocin and all. So it led her to bleeding. She was bleeding profusely. And I was there. I'm like, what is happening? I know what can happen if a woman is bleeding. If a woman is just had a child and she's bleeding, I know what can happen. In a couple of minutes, it's not even minutes, seconds, she can die. She can pack. The same way, you see, the same way we are sitting now, is blood. If that blood is flowing out now, you won't, in seconds, the person will be gone. And I was panicking. Even as a midwife, I was panicking, looking left and right, shouting. And not that, but I was grateful to God that she survived. They were able to rush her into the theater. Surgeons were available. Now think about it. Let's look at it in the community level. Let's assume that woman in the community level, or let's assume that my friend is in the community level, and there was no surgeon to operate on her. There's nobody to rush her into the theater. What do you think would have happened?
Would have died.
Would have died, exactly. So when I saw that, I'm like, what? Is this how people die? Okay, then I was just pregnant for my baby or something. I've not delivered. I delivered my baby late 2021 or so. So I was like, is this how people die? Oh my goodness. Yes, I know that's how people die, but I was just seeing another reality because it was someone so close to me and all that. I was like, okay. And then I've had experiences in the past during my schooling. You go to the community, you see women. I've seen several cases of how women die. I've seen several cases of no equipment. I was in a community one time, and there was this woman in labor. I was supposed to take her delivery. I'm like, oh, give me glove. And the person in charge was like, you have to get your own things. I'm like, what do you mean I have to get my own things? I want to deliver this woman. You say I have to get my own. You say, that's how we do here. Everybody will buy their things and keep. I mean, everybody will buy their things and keep. I don't get it. Is that how people operate here? There are things that are supposed to be sterile.
Yeah.
There are things that are supposed to be that, okay, once they sterilize it, everybody should be able to, if you as a midwife or as a doctor, you want to take a delivery and you need a sterile equipment, everybody should be able to have access to that point. You mean you guys don't have anywhere like sterility or anything? They say, no, they don't have. Everybody buy a thing and keep in the cupboard. Once it's time, you want to take a delivery. I'm like,
wow.
What? Do you understand? So that was putting those two experiences together, both the ones I had in the community and the one of my friend. I just felt like, okay, you know what? I'm not going to keep complaining. I'm not going to keep talking. I think I need to take action. And that was where the whole idea of Lok Natal Care came. Initially, I wanted to run it as an NGO. I'm like, if we run it as an NGO, how are we going to fund it? I can't come to your DM and say, oh, I want money today. I come to another person's DM, I want money tomorrow. If I come next tomorrow, nobody will answer me. They will see my message and just lock it up. Do you understand?
Yeah.
They say, okay, for us to be sustainable, the only thing we can do is running a social enterprise, right? We're a social impact organization. We are just making a little bit of fun for sustainability purpose, not because we want to make money for spending on all that, but for sustainability purposes, for the volunteer that work with us, for our website. We have websites. Website does not care. If you like, don't do anything. Once the time comes, they will shut it down, collect your domain name if you don't do on time. We have those graphic designers, we have all those things. We need funds for sustainability.
Yes.
I said, okay, the goal is to make an impact, but to sustain that impact, we need to do something.
I'm with you on that. I mean, to be honest, it has given you the leverage to make more impact, to be honest. And that is why I look at your page, I say, okay, I think I understand why you're still going. You're running as a social enterprise.
We can't run as an NGO. We can't keep up. Because even those you're writing funds to, you see this thing, I tell people, if you want to step either into running an NGO, so think about it, because the first 3 years, the first 3 years will determine if you're going to stay or you're going to pack up, because you'll be frustrated. Unfortunately, without funds, you can't do a lot.
You can't do anything.
In fact, you can't do anything. Don't let me say you can't do anything.
You can't do anything. Revolutionizing healthcare delivery.
When I saw it, I'm like, what do you have in your mind? Well, anyway, I'm always prepared. So whatever it is.
People in the rural area, I think they don't have access to this information right now.
Yeah.
How do you use the digital era to reach out to the people in rural areas?
Okay, so to start with, just like I said, we're running. I tell people anytime people ask me about Lok Natal Care, I tell them we're running in 2 ways. When I mean 2 ways, we're running on the community levels. Those are our focus audience. Those are our target audience, right? We're just leveraging social media to, let me say, to put our impact out there. Because unfortunately, you have to put yourself out there, either you want it or not. If you're doing beautifully where you are in your community, if nobody is seeing your work, it's as if you're not doing anything.
That's true.
So in as much as we are working in the community level, we also want to put our work out there. And that is where the digital era comes from.
Yeah.
We use the power of storytelling, we use the power of talking. That is how we're able to put our impact. So our target audience are more in the community. Like I said, when my friend was in that phase, I was thinking of it. If that woman is in the community level, what would have happened to her? Right? That was what was striking my mind and all that. So we have our target communities. For example, I don't know if you know Maternal and Reproductive Health Collective. They're working on, if you check them online, they're working in Lagos.
Oh,
State.
yes.
You know by
yeah.
Dr. Abosede, you know her.
Yeah.
So their target base is Lagos. Our own target base is Ogun State.
Oh, right.
Yeah, so we are trying to cut across rural communities in Ogun State, penetrate them, bring them together in their respective communities. Okay, what are your maternal health issues in these communities? We've gone to communities, we know that they definitely have maternal health issues because the infrastructure is not there. Most of them, when you go to primary health care, what's it called? The structure, you like, what is happening? What is going on? I was in a primary health care, myself and my team, that was last 2 weeks. So we just got another community, still in Ogun State, that we wanted to penetrate. So when we got there, I was like, okay, can you tell us your statistics for the month, for the number of women that come into the facility, for the number of childbearing? And like 0. I'm like, 0? What do you mean? There are women in these communities, they're having babies. So where have they been delivering their babies? So yeah, these women, they use somebody in the community. Like somebody in the community, someone that is not trained, someone that is not skilled, someone that is not using sterile equipment and sterilization. These are where the issues come from.
Wow.
When a woman is delivering a baby in an unsterile environment, and they use probably a razor blade that is not sterile or a knife to cut the umbilical cord, you are doing 2 things. That unsterile razor blade gives infection to the baby and to the mother. As you cut, it goes to the baby. As you cut, it goes to the mother. Both of them will now suffer sepsis. Before you know, they are running temperature. Before you know, they are shivering. Before you know, they are dead. Infection has gone into the bloodstream. Do you understand? So when I asked them, back to the primary care, when I asked them, they said 0. Why are these women not coming? So because they don't want to come to the facility, because this, I knew that there was going to be a lot of maternal health challenge in that community. Because if they are not coming to the primary care, that means they are delivering somewhere. And if they are delivering we need to see the places they are delivering. We need to see if it's okay. We need to see the number of maternal mortality in that community. Do you understand? So I kept thinking, there's a lot to be done. Do you understand? But we can't do it all at a time. That is why Lok Natal Care is going from one community to the other. But we have a focus area. Because if you browse online now and check the number of local government area in Ogun State, you will see that it's a lot. It's a lot. So what we want to do is get to them one after the other. When we get to them, do our survey, bring them together, do our impact. Like, we're not leaving them alone. We're working to them like back to back so that we can track the maternal mortality in that community from one community to then incorporate the statistics into the national statistics.
Wow.
Do you understand?
Yes.
Do you understand how we're working?
Yes.
We incorporate statistics into the national stat because if anybody from abroad, or if they, not let me say from abroad, either from World Health Organization or anywhere, if they want to take statistics in ECME,
there's a database.
There's a database. So they go to that database. So that is why our work, we can't do it alone. We're involving stakeholders, we're involving community health workers, we're involving even the governors, the governor of Ogun State and all that.
Right.
Although we still want to have a meeting with him and all this stuff.
So how has that collaboration been? Has it been responsive?
It's a lot. I won't lie to you. Because when you go into the community, there are two things. On the part of the community people, they feel like, oh, you have gotten a fund somewhere. So you want to, they're expecting so much. I tell you, see, when I go into the community, I'm saying, you've gotten money from federal government. I'm like, which federal government? We are a social impact organization. We are trying to close the gap that they cannot close. We are a CSO. You guys don't get it. You think we have money somewhere. We're struggling. We are looking for ways to make sure we run our project, to make sure that we are doing this thing, to make sure we close the gap. Government cannot do it alone. The private facility cannot do it alone. That is why the CSOs and stakeholders are there to fill in the gap. That is what we are trying to do, to fill in the gap. And if you feel like, oh, we are bringing money somewhere, they have that orientation when you come to the community. Is that you give them money, is that it's a lot. So then that's one from the aspect. Then the second part of the collaboration from the healthcare providers, you have to do a lot of meetings, you have to do a lot of community entry, you have to involve the local
community leaders
and all that, so that they will cooperate with you. Because when you go into the community level, the truth is, I've gotten a lot of times that I go into the community level, the people there feel like you want to probably take over their job. I'm like, it's nothing like that. You're collecting your money from the federal government. I'm not collecting your money. It's not going to affect your work, but we need to work together. We are helping you to pull these people out of their community or whatever it is they are doing, their maternal health issues. We are bringing access to them. We are bringing health education to them. We are bringing information to them. We are bringing knowledge to them. We are bringing a whole lot of things for them. That is what we are doing. And then we are incorporating it into the health system and say, okay, when you want to deliver your baby, we have partnership with these people. Please always come. In fact, we are holding them by hands because we check, we do everything. Always come. Deliver here because these are the places we can track our statistics. These are the places we want to know how many women are dying while they're having their babies. We want to know the reason why you are dying. If there's a problem, we want to track you. We want to assess you. We want to be able to capture our statistics. And this is the reason we are saying, come this way.
What makes your platform easier than the other platforms? Are you easy to access? Are you affordable?
Yeah, well, I would say that.
Okay.
We're very easy to access.
So this is my final question to you. What is your community call to action?
Okay, in terms of, break it down.
In terms of your project now, what are we expecting? What are we looking forward to from you?
A lot.
Please.
A lot. It's quite interesting that, let's say, some organizations are seeing what we are doing, and people are reaching out to us and say, oh, we'd love to collaborate with you, we'd love to do this. For example, we had was a lactational consultant. And she said, oh, man, I love what you're doing. It's beautiful. She's building a breastfeeding clinic. And she's like, oh, this aligns with me. You know, when we come together, the women in your community, they could have access to our breastfeeding clinic, this and that. I'm like, oh, that's a beautiful collaboration. The other woman that is working on mental health, she was just me, oh, well, this and that, I love what you're doing, blah, 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 blah. You know, the women in your community could benefit from our mental health, accessibility, and all that. So even when people are not seeing the things on the other page, people reach out to me. Like, they go to once they type in my name on Google, fortunately, my Google brings out a lot because of my presence on LinkedIn.
Activeness, yeah. On
LinkedIn, that's what LinkedIn does for you.
Yeah.
I tell people, if you search your name on Google and you don't see anything about you, it means you are not active on LinkedIn. If you're active on LinkedIn, LinkedIn will boost, it will go directly to Google. So once people search me like that, it takes them to my LinkedIn page. From our LinkedIn page, they see what we are doing, they want to collaborate with us and all that. So the call to action is, we have a lot to do. In fact, there is a whole lot of things to do on the community level, especially when it comes to maternal mortality crisis. For example, the SDG goals was to ensure that we have a reduction in maternal mortality crisis by 30% before 2030. 2030 is just in 5 years. And now our statistics ratio has gone more higher. We are not even where we used to be. Before they say by 2030 we want to achieve this. We have gone higher. We now have a higher maternal mortality statistics in Nigeria. It means we have to put our hands on deck. We need to do something. We need to go into the grassroots, into the community level, and bring out these people and say, how can we intervene? What is the problem? How can we solve it? How do we do strategic thinking and say, this is what we need to do, this is what we need to do. These are the ways we need to put our statistics. Because one of the things that is affecting Nigeria as a country is that we don't report our statistics very well. You would agree with me. We don't. There are so many statistics that are not captured. Trust me. Even the one World Health Organization is saying, oh, Nigeria maternal mortality statistics is this. Trust me, it's times 3. Because there are so many places that those statistics are not reported. So we want to do a lot on our community level, still working with our community, and see how we can report more of our statistics into the national level. Your
volunteers, you have volunteers working with you?
Do.
Yeah? Like how many volunteers would you say you have right now?
We have about 12.
How do you attract your volunteers?
There's so many ways we attract our volunteers. Number one, we have women in our communities that say, oh, I like what you're doing. I'd like to still volunteer. I'm a mother. I would like to still volunteer. Right? Number one, that's all access. Number two, we put it out there on social media. Oh, we are calling for volunteers. You can put our website. Of course, it's in our link tree on our page. Check our website, see what we are doing. If you're interested, reach out to us. We put criteria there. We want so person, someone that is interested in building their capacity development, community entry, media skills, what we want, depending on what we want, we put it there. Then once we get you, or once you write, the last time we called for volunteer was in April, although we've called for another volunteer now. Okay. The reason why I didn't mention this one is because we've not onboarded them yet. Okay. But the last time we called for the last volunteer that we onboarded was in April. So we had about 50 people reach out to us. We had to narrow them down to 8. Because we want people that are ready to commit to the things we do, to the activities that we do, regardless. You know how social impact organization is now. We're not paying you salary. Do you understand? And it takes grace, and it takes someone that wants to impact back. That wants to give an impact that for them to say, okay, I'm ready to work without salary. People are looking for money. Everybody's looking for money. You're waking up day and night, you're looking for money. You're running this show because you want money. Do you understand? So everybody wants money. So when you're telling them, oh, you're coming to volunteer, you're going to do this, you're going to do that, and then there is no money, a lot of people give up on the way. A lot of people say, oh, they're not doing it again. Life has happened to them, which I understand. I don't force our volunteers. However, I tell them there's a lot of things for you to benefit. Aside from the fact that you're learning deeply rooted in how community entry works, how public health runs, and all that, you should be happy to associate with a brand like us. Don't worry, we'll get big. When we get big and they say, oh, Lok Natal Care, you'll be proud and say, yes, I was a part of this community, or I am a part of this brand, I'm a part of this organization, and you live to tell a beautiful story. So yes, we have volunteers, but volunteer management is a whole whole lot.
Yes.
A whole lot.
Yes.
Because there's no money, we are giving incentives. I run the organization based on personal funding and the money we're able to generate from our courses. We have courses that we sell on the brand. We have antenatal courses. We have maternity courses. We have a whole lot. They are on sale. They are very extremely affordable because we don't want it to be too expensive. Because the major reason why we are doing that is not because we want profit, like I said, it's for us to sustain whatever it is we are doing at the organization. But nonetheless, even at those money that we are generating there, it's not enough with what we do in the community. We also provide relief packages. I don't know if I told you that.
I've seen
if
that.
You go through,
yes.
We also provide relief packages. And when I mean relief packages, we provide comprehensive antenatal packages there in terms of medication, in terms of pad, in terms of... we pack a lot of things there. It's money we are using for these things. I'm using money from personal pocket to understand. So if I have to combine the money we are using from personal pockets and then having to pay volunteers, you can see it's a lot. It's not easy for people to say, oh, I just want to volunteer for an organization. But for you to be part of us, for you to believe in the dream of what we are building, we truly appreciate. So see that happiness, me and happiness, we're like this. I try to make them happy as much as I can. And if they are listening to this, they can as well testify that when it comes to Miss Kauthar, no. She's trying her best.
That's nice. That's nice, Kauthar. So before I let you go, I want to ask you, in all of this right now, that one challenge that you're facing right now, what's that challenge?
Funding. Can I call funding a challenge? Funding is our greatest challenge. And what we are doing to curb that is we're trying to see how we could apply for grants to help. So I'm always like on the go, looking out for opportunities, then carrying the team members along. You know what? For this year, I told them at the beginning of this year in January, I told them we need to make so number of money for our brand. And for us to make it, we need to apply for, before an organization will say you want to win a grant, you must at least apply for 20. When you apply for 20, if one comes through, fine.
But I'll tell you the truth before I let you go, to be honest. I've seen your page. Your page does not look like, I can't see any cry for help on your page.
It's not that we don't cry for help, but we don't just put it out there. I mean, we don't tag it out there.
Why?
We cry for help personally.
No, you're doing impact, public impact, so it should not be personal.
Yeah, well, I agree with you on that.
Do you understand? Nothing personal about it.
I agree with you on
Kauthar,
that.
Thank you so much for coming here.
Pleasure.
Thank you so much. Thank you for meeting you in person. And like I said, if I want to hear again,
that girl has been disturbing me. Joy, I'm like, just mind yourself and leave me alone. Joy has been in my DM and said, oh, these people, like, did they give you something? Because I don't get it.
Thank you, Joy.
You're welcome.
Yeah, thank you, Joy. Thank Joy on my behalf. To be honest, just say thank you so much, Joy. So I want you to look at the camera and, just one word, tell them exactly, what you need, what you want, like that. Cry for help right now. Okay. Do it for me.
Hi, everyone. My name is Kauthar Opeyemi Lawal. I'm the founder of Lok Natal Care. I'm a maternal and child health advocate, and like I said, we run a social impact organization, Lok Natal Care, and this is us, or let me say this is me, crying for help. We are asking for collaboration, we are asking for partnership to reduce maternal mortality in Nigeria. You could go through our page, we have Instagram, our website, our LinkedIn, to get to see each and everything we are doing. We are on the community level, we are on the grassroots, where maternal mortality is extremely high and alarming. So we are trying to bring these women together and see how we can offer solutions to them. Not see how, we're offering solutions to them. So if this is you want to partner with us, you want to collaborate with us, you want to give us funds, please feel free to reach out to us to support the work that we do at Lok Natal Care. Thank you so much, and God bless you.